either way, the pelvic floor is supposed to relax. And that gets lost. Everyone thinks that strengthening your Kegels and your pelvic floor so much is what's going to help. And that's not always the case. So I find that the majority of people that walk in our door have too much tone or too much tension in their pelvic floor. And it's learning how to manage that and coordinating it with all the other things that are supposed to happen for function.
Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Chrissy Pfeiffer, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this. What's up, warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, and I am so happy to have you back here listening to this podcast once again, because if you are a woman, especially a woman in midlife, this episode is absolutely for you. We are going to talk about something that I think that a lot of women don't know about, aren't well versed on, and we're going to get into all the nitty-gritty about symptoms, pelvic floor dysfunction. We're going to talk about it because I have an expert on the podcast today, and I feel like this is something that as women we need to talk more and more about and learn more and more about for our own health and wellness. So let's get right into the podcast. I'm going to introduce my guest today. Her name is Meghan Tierney Lash. And Meghan has worked in the field of outpatient physical therapy for over 24 years with a strong background in orthopedics and pelvic health. After graduating from Duquesne University with her Bachelor's of Science in Health Sciences and a Master of Physical Therapy, she began her career in Health South in Phoenix, Arizona, where she had the opportunity to work with a wide variety of patients from high-end athletes to the elderly. After a year at Physiotherapy Associates in Tempe, she moved to the Los Angeles area for a position at the Cypress Center, a private practice in Pacific Palisades, owned by a good friend and colleague. While there, she became certified in Pilates through Bossy Pilates and learned the value of treating one patient per hour in a unique, inclusive setting. She brought this concept home to Philadelphia in 2010 to One Physical Therapy and Wellness, a boutique one-on-one physical therapy clinic and Pilates studio was born. It was here that Meghan became passionate about pelvic health as friends, colleagues, and patients were having children and pelvic floor issues were becoming a bigger conversation. She trained with Herman and Wallace, and with the addition of staff trained in treating pelvic floor, she helped One Physical Therapy to become a leader in the Philadelphia area pelvic health world. She believes that pelvic health is best treated with an orthopedic lens and feels that her one patient per hour model with an emphasis on manual therapy and patient education is a natural fit for these patients. Welcome to the podcast, Meghan.
Thank you. Thank you. It's so great to be here.
I'm really excited to have you on because I think that, pelvic floor is not really a term I think that most women know. As a nurse, I know about it, but honestly, even with my clinical background, I feel like the only thing that we learned or talked about, or as women we talk about, is like most women know about like doing Kegels to quote unquote strengthen your pelvic floor.
Right.
But there's so many, it's so much deeper than that. The pelvic floor is responsible for so much more of our health and wellness. And it can be kind of complicated. And we use our pelvic floor for so many different things. And like you said in the bio, like having babies can disrupt the pelvic floor. There's so many different things that we're going to get into today. So I'm really excited to get into the conversation about it. But before I do that, tell us a little bit about yourself and a little bit of a deeper dive, how you got into PT, physical therapy, and then really focusing on this Pilates, pelvic floor type of manual PT.
Yeah, absolutely. So I, like many physical therapists, I was an athlete. I was a pretty classically trained ballet dancer, and I played field hockey and lacrosse, and I kind of pretty much did everything. So a couple injuries kind of led me down the physical therapy road, and I became really interested in orthopedics. I originally, like many PTs, wanted to possibly be an orthopedic surgeon or a physician, and eventually just decided I didn't really want to go to med school, but I still wanted to try to learn. I had a really heavy science background. So I really wanted to try to learn how to help people through physical therapy. So I went to a 5-year master's program and was able to get out and start treating. I started in the sports world in orthopedics. I was like what the bio said, I won't repeat that, but I saw a lot of high level sports athletes and sort of a lot of just general active population, which was great. And I loved it and took a chance to follow a friend out to California. And I feel like that's where everything changed for me. And that sort of set the stage where I would be ready for something like pelvic floor. I mean, we learned about pelvic floor therapy in school, but it just seemed so foreign. Like, oh, if you have a baby and you're a female, then you would do that. But I didn't really get it, that it encompasses everybody. We all have a pelvic floor, right? It's muscles. So we all have one. So as I was in California and learning to treat 1 hour, spending time with people, understanding what the root cause of the problem was, having that model allowed me to really get to the root of a problem. We put our hands on every patient, and, Pilates was just a great adjunct. Pilates is wonderful. And when done well, is a great adjunct to helping with your pelvic floor as well. I came back here and decided that there were no one-on-one clinics that I knew of here in the Philadelphia area. And I started my own. It started just me, and we have, there's 24 people working for me now. So it's quite a big operation with 2 locations, like I said. But I think it was around, I don't know, maybe about 10 years ago. I mean, my son is 9. So it didn't exactly coincide with when I was pregnant, but I just started seeing more patients that were also talking about pelvic floor. I had a couple staff members that treated it. And I was like, wait a minute, this makes sense. So they were treating back pain differently than I was. They were thinking about the inside muscles as well as the outside muscles. And I was like, wow, why I was like kind of on the forefront. And then, maybe just after having a, 10-pound, 13-ounce child by C-section, I was like, wow, maybe I should sort of see what's happening. And I decided to start going to some classes. And I really now will tell you, I treat all of my low back, hip, SI joint patients differently because you have to take into account what's happening at the pelvic floor. You're right. It's so much more than Kegels.
Yeah. I mean, it really is amazing that there's so much to it. So you were talking about like root cause of some pelvic floor dysfunction. What are, should we talk about symptoms first or root cause?
Sure.
Let's talk symptoms first. Yeah.
Yeah. And people, I feel like, and if you talk to any pelvic health therapist, you're going to find out that we are talking about this at parties. Like, we talk about this all the time.
I love it.
It's because it's just not talked about enough.
Yeah.
Well, pelvic floor symptoms can be anything from the obvious. I think this is, we're sort of focused on middle-aged women right now, right? The probably the biggest things that a middle-aged woman's going to notice is, urinary leaking when you cough, or feeling like as soon as you have to go, if you don't get to the bathroom, you're going to leak. Painful sex is a big one. But also, constipation is sort of a pelvic floor situation. It can be pelvic pain. It can be the inability to put a tampon in. It can be things like that. Those are all different things that would signify, hey, we should sort of look at the pelvic floor and see what's happening.
Yeah. I mean, that's really interesting that like something like a constipation, that most people aren't going to think about pelvic floor dysfunction and back pain, right? Yeah. Like you were saying, like, I feel like a lot of people wouldn't go there and think that it's pelvic floor that could be causing lower back pain, tailbone pain, all of these things.
Pain, hip. Yeah.
Hip.
Yes. I mean, I didn't mean to interrupt you. It's not like all low back pain involves that. But if you look at it sort of anatomically, you've got your pelvis, you've got all the muscles that attach on the outside, you have the muscles that attach outside your hip. And then you've got these pelvic floor muscles at the bottom of this like bucket, right? So they're holding your organs in. They need to be able to contract, right? They need to be able to, I mean, we can get into why. They also need to be able to relax, and they need to be at a good tension level to hold everything in place. So if those three things aren't happening, maybe they're not happening because there's a spasm in the low back, or a hip muscle's too tight or not working properly. They all have to function together. So often, persistent back pain, someone might be kind of like using their muscles incorrectly, and then they're just not getting better. So sometimes we come at it that way.
Okay, so as you're talking, I was thinking we jumped right into
Yeah,
symptoms.
jump right in. Sorry.
No, I love it, but I feel like maybe we should back up to just explain to some listeners that may not understand, like, what exactly are we talking about when we're talking about pelvic floor?
Yes, exactly. So, in women, we have three openings. Most people are familiar with where their urethra is, their vagina, and their anus, right? Those three openings are at the bottom. All of the muscles that surround that, and there are three layers of concentric muscles that are around that. They sort of form a bowl kind of at the bottom of the pelvis. If you're looking at a skeleton, those two hip bones, they
Yeah.
I should have brought a motto with me. I didn't think. But
That's okay.
they
We'll
sort of,
visualize. We'll visualize.
yeah, they sort of form a bowl.
Yeah.
I think one of the most important things to understand is they hold our organs sort of in place, like the uterus, and everything sort of is held in place there. But the pelvic floor muscles need to be fluid, and they need to move. So when we take a nice deep breath in, like our rib cage needs to expand, the diaphragm pushes down, that pushes down and increases the intra-abdominal pressure, and the pelvic floor needs to be able to move. So these muscles have things that they need to do, which gets back to your earlier comment about Kegels. Strengthening them isn't always the answer. Sometimes it's
Right.
lengthening them. Sometimes it's understanding when they should be active, when they shouldn't be active. And incorporating things like breath and stretching and getting the right muscles on is all part of the picture. So I hope that's not too confusing, but there are muscles that do what other muscles do. They support, they also move things. So in sexual function, the pelvic floor contracts. You're trying to get the sperm closer to the egg, basically, right?
Yeah.
So that's what happens. But on the flip side, when we're trying to eliminate, either have a go to the bathroom, either way, the pelvic floor is supposed to relax, and that gets lost. Everyone thinks that strengthening your Kegels and your pelvic floor so much is what's going to help, and that's not always the case. So I find that the majority of people that walk in our door have too much tone or too much tension in their pelvic floor. And it's learning how to manage that and coordinating it with all the other things that are supposed to happen for function.
Wow. Yeah, that's interesting. That is something that you probably don't realize, that it can be hypertoned, right? And have too much, because it needs to be able to relax in order to do all of its functions.
Yeah.
So it's muscles. Is it, when we talk pelvic floor, are we also talking about like tendons and ligaments and all of those things too, that sort of hold it together?
There's some ligaments that kind of help form the SI joint and the pelvis and around there. Quite honestly, lots of tissue and fascia.
Tissue and fascia.
And
Okay.
the fascia that's sort of holding all of our visceral organs together, stuff that's forming the sides, of the vaginal wall, which does have some, pretty much just tissue. So I would say mostly muscle and fascia and tissue.
So for women that have had children, whether vaginally or via C-section, how does that disrupt the pelvic floor?
Sure. It's a great question. I'm even going to say before a patient even delivers is where that can start. So think about it as we, grow a human, which is like a really cool thing. That typical pregnant posture where the belly's out in front and the back starts to arch a little bit. And, you kind of see that on people. Already just adding weight to the system is causing your pelvic floor to have to function differently, right? And we talk a lot about where in a normal human with good posture, where the rib cage and the pelvic floor need to be kind of lined up for it to work well. Well, that just goes out the window sometimes. And then someone's growing this baby, things start to hurt, they stop moving properly. So maybe they start using their pelvic floor as more of a stabilizer. And then it becomes a little too tight. Or maybe, I don't know, it just changes the mechanics and some old injuries start to be at play. So that can all happen. And then obviously when we birth a child, the baby has to fit through that vaginal canal, and there's lots of stretching and tearing and ripping and sometimes like that. and then like a C-section. Anything that kind of so if you just, I keep talking about the rib cage to the pelvis and that whole unit, anything that opens that up. So even if it's like, gosh, an appendix surgery, like we can go there too, but you're going to open up and take this kid out, and all of a sudden muscles aren't firing, nothing's in the right spot, tissue's healing, but then we're sort of doing stuff. We're picking this kid up. We're going up and down our stairs. We're, managing our toddler while we're doing all this stuff. And you're asking the system that really needs, proper care to do a whole lot of stuff. And so that's where a lot of stuff starts.
Okay. So besides pregnancy, what are some other causes that could cause pelvic floor dysfunction?
Wow. Yeah. Lots of different.
The list is really long.
The list is long. I mean, listen, so I would say even abdominal surgery, low back surgery, hip surgery, anything that disrupts that area. You may have heard, I don't know, this is probably something we talk about as PTs all the time, but like someone who's hypermobile. So hypermobility or EDS, Ehlers-Danlos syndrome, someone that's sort of hypermobile, you think that in order for their body to move and live in the world, there's going to be tension somewhere. Often that's at the pelvic floor.
Okay.
It could be someone runners. I mean, right. We got someone who runners and high-end athletes are putting a big, tax on their system. And if that pelvic floor is not functioning during these movements, then you can have some dysfunction. Plenty of other, systemic disease processes can sort that too.
Which I would assume menopause being something because of, that's a big one. But I mean, just because of the perimenopause into menopause, because of the fluctuation in hormones, and then the effect that has on all of our tissues in our body, including our muscles, and just the fluctuation of hormones, the decline in our estrogen, that can and then obviously the sexual dysfunction that comes along with menopause as well.
Sure.
So I'm sure that could be a big cause of pelvic floor dysfunction as well.
Well, and going back, even just sexual trauma, like without anything else, a teenager that might have had sort of a bad situation and then kind of that sort of compounds. Like if you imagine any insult to a muscle, the muscle's going to go like this, right? So we sometimes see that. I think that it's also, this is more experiential. I don't have a lot of evidence, but I have to say at least 60 to 70% of people with jaw and cervical and TMJ pain are going to have a pelvic floor issue.
Wow.
And it has to do with where we hold our tension. We've got a couple diaphragms in the body. We've got sort of this neck and jaw. We've got our actual diaphragm, and then we call the pelvic diaphragm. And if things aren't moving and the tension on your body from life and gravity and everything else isn't working, sometimes that's a big thing. And, like you said, you might not even know you have pelvic floor dysfunction. I might be treating someone's neck and find out they only poop every 3 days. And I'm like, oh, well, so nothing's wrong now, but let's try to clean that up for you a little bit. So,
yeah. Okay. So pelvic floor dysfunction, we talked about all of the symptoms, which there are a lot.
Yes.
We talked about root causes, things that could cause it. So now what? Now if someone has pelvic floor dysfunction, what do they do about it?
Right. What do they do about it? Okay. So in the state, I'm in Pennsylvania. So we're in Pennsylvania. You can refer yourself to physical therapy if you're not on a Medicare plan for 30 days to come in and have someone take a look at you. But for the most of the time, I tell people to just talk to their doctor. This is sometimes hard though, because a lot of doctors are like, what are you talking about? Gynecologists are often a good place to start. I usually tell people, have a conversation, say, listen, I heard something on the radio, or a friend was talking to me, I'd like to go get evaluated. And really that's where it starts. You just get in front of somebody, and, the first pelvic floor eval is quite a lot. We ask a lot of crazy questions. But for the most part, it's trying to find out how the health of that whole system is. But you can self-refer. And I firmly believe that that's great for sort of like our age group to just kind of get in there and have someone take a look. And then it's on the physical therapist to say, hey, I'd like you to get some tests or go back to the doctor and get a little bit more screening. But for the most part, we can do that initial without an issue.
Yeah, I think that's such an awesome point, because I think a lot of people don't realize that you can self-refer.
Yeah.
I think a lot of people, when you think of physical therapy, I know, at least for me, I think, I need a doctor's prescription
Mhm.
in order to see a physical therapist. So the fact that you can self-refer and get in there and start seeing what's going on and what's wrong
Right.
is huge. Because to your point, I do think it takes a certain kind of doctor. So whether it's your GP, your gynecologist, whatever doctor, not every doctor is going to recommend pelvic floor PT.
No,
They're not. Well, I mean, because I just feel like that's something they don't really even know about. Maybe the
no.
gynecologists are a lot more versed on it, but that's why we're doing the
And
podcast.
it is getting better. I liken it a lot to, when I first started treating, 24, 25 years ago, conservative management for low back pain was medicine and, an MRI, right?
Yeah.
Let's just go. And now they're like, you know what? Go to PT, let them figure it out, right? So it's taken a long time to get to that point, and I'm really hoping with pelvic floor that we're getting there. But yeah, there more and more doctors are understanding that this can be sort of an issue.
That's it's great. It's great for people to know about it. So, okay, so then when they come to pelvic floor PT, you have Pilates machines and
Yeah.
you're incorporating some Pilates. Tell us a little bit about that, how the Pilates
How we
is
work
also,
together.
yeah,
Yeah.
being,
So I feel like at first, so when someone comes in, it is sort of the first visit and maybe a couple visits of getting a complete picture of how this person's body is working. So for a pelvic health eval, you may talk a little bit about that, what that sort
yeah,
of entails.
yeah, sure.
So we're going to be talking about, medicine, history, birth history, abdominal surgery history, all sorts of things, right? So it might not seem relevant that someone's, left ankle surgery in high school has any effect on the pelvic floor, but if they've been compensating that for 10 years and then had a baby, there's many things that we can look at. One of the things we like to talk about as like a baseline is how much are you peeing during the day? How many times do you go? Do you get, oh, I
Yeah.
forgot. Another big symptom is nighttime urination. It is, we'll say
Nighttime.
on the
Okay.
normal end, once you're over a certain age, one a night, but like for, this, I guess we're sort of talking this like 35 to 55. I mean, really, you're not supposed to be getting up in the middle of the night. And
Right,
there is
right.
a reason why that's happening. So
Okay.
we're talking about bladder habits. How many times a day do you go? Do you ever leak? Do you ever have an urgency? Do you get up in the middle of the night? And then we'll talk about how many bowel movements do you have a day? Is it every other day? And
Yeah.
then that sort of gives us a picture of how this person is. And that's the easy stuff to clean up. We talk about hydration. We talk about how much water someone's drinking, how much coffee, how much wine. All of these things can be a
Yeah.
little dehydrating, and we try to get a picture of what this person's system looks like, plus all the orthopedic stuff. So we'll start there. And often the first day we don't even do an internal exam. Sometimes there's just too much to get through. But in the first couple visits, if necessary, I always feel like it's important to get a baseline of what the pelvic floor looks like and feels like, so we can see if we're doing any better. But not everyone needs work there.
Yeah.
Everyone might need work externally or on habits or other things. So I would say that once we get to the part of releasing and getting the person to sort of understand why things are tense if they are tense, and we start building things back up in a healthy way, that's where Pilates comes in. So
Okay.
using our Pilates machines or even just mat work to reteach someone how to breathe and use their core appropriately without sort of that Valsalva and holding and things that screw up the pelvic floor.
Yeah.
That's where Pilates comes into play. And for a lot of people, that becomes something that they want to carry on with, right? They fall in love with Pilates, because I'll tell you what,
Yeah.
one-on-one Pilates is the best thing in the world. Having someone with you, teaching you and adjusting you the whole time is wonderful. And so
Yeah.
that's where the Pilates.
Yeah. Like, and especially on that reformer,
Yeah.
I feel like it is amazing because to your point, it's not, I think learning how to engage your muscles and move
Mhm.
and breathe
Yeah. Right.
at the same time is so hard.
It is.
Right. And
It
it's
is so
not
hard.
an easy thing to do. And if someone is there reminding you, telling you to engage, but telling you to breathe and telling you to do all these little things, it really makes such a big difference in your body. And then carrying that habit around instead of like holding all that stress in.
Right. Exactly. Exactly.
Yeah.
So it's I would say Pilates would be more the build up phase or more, I mean, I would say we do you're going to see a lot of carryover with yoga in the beginnings of pelvic health, right? Because
Right.
yoga sort of utilizes more diaphragmatic breathing versus sort of that, what we call posterolateral breathing or 360-degree breathing with Pilates. And we're trying to get the diaphragm to expand. We're trying to get the belly to expand, and that drops the pelvic floor. So you might come to pelvic floor therapy and find yourself in a lot of child's poses or happy baby or things like that. Those are all, so I would say some of that beginning stuff, there's a big yoga crossover as well.
Okay. And so if people are listening now and have symptoms of, like frequent urination at night, which,
Yeah.
is very disruptive
Yes.
to life because
Right.
then you're not sleeping and
Right.
and not only are you getting up, but then it's very disruptive to your sleep. So let's just focus on that one for right now. You're saying that that's something that like pelvic floor PT, which I think a lot of people wouldn't think about,
Right.
is something that's kind of like not an easy fix, but sort of.
Sometimes it is.
Yeah.
I mean, I think my first question to someone is always, and it depends, right? What's the age of your kids and what's happening?
Yeah.
Are you going to the bathroom because you're up, or are you getting up to go to the bathroom?
Right.
So those two questions. If the answer is I'm getting up to go to the bathroom, or I wake up and I feel like I have to go. So for the most part, if during the day your bladder is not emptying completely, and you're sort of retaining some of that urine, you may find yourself having to get up in the middle of the night. That would be one. I'm making this super simple. That would be one
Right.
reason.
Okay.
Another reason might be you were busy all morning, didn't drink a ton of water, and then like pounded a lot of water at dinner because you felt thirsty and you felt dehydrated. So sometimes it's as simple as adjusting your hydration levels during the day, learning some better bladder habits to make sure you're completely emptying during the day so that you have a less disruptive night. That would be like the simplest way I could say it.
Yeah. Okay.
Yeah.
And then the women that, have leakage, like
Yeah.
from bladder leakage from sneezing and
Uh-huh.
coughing or jumping, which, again, is usually from pregnancy
Yep.
and childbirth.
Yep.
That's something too. That's another symptom that pelvic
Yeah.
floor PT can really address.
Well, and sort of, I'm going to start sounding like a broken record. It's very similar in the fix. So
Okay.
if you are not similar, but if you are, we call that stress incontinence, which means that you're incontinent because there's a stress to the system. So
Yeah.
you cough, that forces the diaphragm down, and whatever. So most people are going to leak with stress incontinence because their bladder has not been emptying fully for whatever reason. So it's sort of getting to the bottom of why that's even happening. And then it's, maybe, I don't know, I'll just throw a situation out there that we see a lot. Someone's pelvic floor is a little too tight and more high tone.
Yeah.
That actually and they're living in that level, right? So we talk about the pelvic floor needing to be at the ground level, like it's an elevator, right? When we do a Kegel, it goes up to the first floor. And when we are supposed to be eliminating in a healthy way, when it's lengthening, you imagine that elevator car going to the basement.
Okay.
Somebody might be living with their pelvic floor on the first floor, right? So
Got it.
when they're supposed to be emptying, it's supposed to drop down. They don't have that. There's some urinary retention. They don't empty all the way all the time. And then we put a major stress to the system, like a jump or something. And then, the urine has to go somewhere, right? It can't stay in there. So
Right.
there's that. There's also a neurological sort of reflex. I'll just touch on it, that when your pelvic floor is sort of tight and contracted, it tells your bladder to shut off. So if your pelvic floor is lengthening and in a better spot, it allows the bladder to actually contract and empty. And to be completely honest, we royally screw that up, all of us. So, I mean, from potty training, hey, do you have to go to the bathroom? No, but you're going to try. Go force, go try. So we sort of set that stage as humans with the way we work and what we do. So sometimes it's just a little bit of education on unraveling all of that. And it's sometimes not any more difficult than that.
Okay. Wow, that's interesting. Another big one I think is, especially for women in midlife, is painful sex.
Yeah.
Could be due to, a lot of different reasons, but none of them are fun. None of them are good.
No.
Yeah. So tell us a little bit about that.
There's the obvious peri and menopausal reasons for like hormonal dysfunction, right? There's that, and that changes the tissue near the vagina. It hurts. So if you think about, it's less extensible tissue. It doesn't have the same blood flow. Everything changes, and it hurts. It hurts to kind of put like that. And that pain generally will cause a pelvic floor tension and all that, right?
Yeah.
So there is the obvious, which I think a lot of people try, topical hormone creams, talking to their doctor about hormones, things like that. But often, if that pelvic floor is, so we're going to consider that tissue just dysfunctional, right? It's not working the way it's supposed to. So if that's a little tight, something else is going to be not. So you have to kind of just see what else is happening. Again, I'm making my job very simple, but in that pelvic bowl, what else is going on? We're going to clean up all the rest of those habits, because a lot of these women are also managing a bunch of kids and a busy job, and they're probably not going to the bathroom when they have to go. And so we're going to clean it up from that end a little. We're going to kind of see what's happening tension wise in the pelvic floor and kind of just optimize what's supposed to be happening in the pelvic floor. And then we can go so far as to even talk about, think sexual positions that might, like, not quite into sort of what a sexual therapist might do. And that is a great resource, by the way. But, positions that might feel more comfortable, things like that, to kind of get over that sort of hump. And it is different as we get older, but just understanding how to manage that. And it might be something where this person might just need to be a little bit better about going to the bathroom every 2 to 3 hours instead of holding it because she's on Zoom calls all day for her busy job and then has to pick up the kid, trying to manage that a little bit, maybe sipping tea or coffee instead of water. So understanding that all of that plays into how all of this works. So I guess you could say we look at it from the other angles to make sure you're doing everything right, so that problem, which does happen, you can sort of minimize.
Yeah. It's amazing too. It sounds like there's all these like little lifestyle changes that we don't think about, right? That it's not just the physical PT or what you're doing with your body or the breath, but it's like these lifestyle changes that we can implement that you don't really think about, like, oh, if I don't empty my bladder fully during the day or go enough, then it's going to cause me to go more at night. And then it's going to cause me to wake up. And then I'm not going to be well rested the next morning. And I'm going to have fatigue. And it's like this whole, spiral or snowball effect of how we feel based on some lifestyle changes. And it sounds like, when you go to a pelvic floor PT like yourself or a wellness place and focus on this, there's all of these little things that you can learn about what you're doing or not doing that can help you to live a more joyful, healthy, well-focused lifestyle.
Yeah, absolutely. And, again, I said I talk about this all the time in like social settings. I kind of annoyingly do, but,
I love it.
And I'll even translate this to the population that's probably older than what we're talking about, right? Our over 65, over 78-year-old women are basically shocked when we try to tell them these things. They're like, what do you mean? What do you mean? And so I feel like the sooner we start creating better habits with people our age and younger, and the understanding about how it's supposed to work, right? How your pelvic floor is supposed to work, what it's supposed to feel like. I think that we're going to have a lot less issues. I think it's just there's a very blanket level of education that doesn't happen here. And in other countries, it does, right?
I totally agree. I think we need to become literally like more intimate with our pelvic floors.
Yes.
And I think as women, a lot of us probably aren't, right? And it's, about learning about that part of our bodies.
Right.
Really. And becoming more intimate with it, knowing what it does, knowing the function of it, knowing if if it's hypertoned or not, just kind of tuning in a little bit more.
Tuning in is a really good thing because, it's a lifelong thing. We see patients and, maybe it doesn't mean you have to come forever, but it means that sometimes you just need that pop in to be like, am I doing the right things? This feels a little tight. Can we kind of get back on track? And I feel like we see that a lot, which we are happy to do because it reinforcing these norms that we don't learn as humans again.
Yeah.
I have to tell you, when I potty trained my son, he's 9 now, I had my brain could not even handle it because I was like, well, I know I need to make him go, but it hasn't been too, it's just hilarious. So
yeah.
And some of that is what we have to do. I get that. But understanding that we're supposed to be relaxing when we're going to the bathroom. We're not supposed to be trying to pee as quick as we can and getting out. And we just all do that.
Yes. Because we're just going.
Yeah. Right. All the time.
Absolutely.
All the time.
Well, Megan, thank you so much for joining me on the podcast today. I really enjoyed getting way more in depth about pelvic floor than I think I've ever talked about.
Yeah.
So it's really great. And I do, like I said, I think it's an education that we all need. Everyone has a pelvic floor. Let's get to know it better, because
100%.
when we do, I feel like, a lot of the symptoms that we're experiencing could be related to something. Oh, little pelvic floor dysfunction could be a little, could be a lot, who knows? But I think the more we know about it, now we know where to go. And it's amazing to know that there's a specialist like yourself, pelvic floor PTs, who can help us along the way.
Absolutely. Yeah.
So, guys, we will make sure that we link all of Megan's information, her website, her PT practices in Philadelphia and in Bryn Mawr, so that you can hear all about it. And thank you so much for joining us on Suburban Warrior. Again, this week, I'll be back next week with another awesome Suburban Warrior to share her story. Be sure to follow us on Instagram, TikTok, YouTube at Suburban Warrior. And are you, Megan, is it One PT Wellness?
Yeah.
On
Our
Instagram?
Instagram is 1PT Wellness.
Awesome. And that will also be linked in the show notes, so you guys can make sure you find Megan there. All right, guys, we'll talk to you next week. Thanks again, Megan.
Thank you so much.